Welcome to Podocyte Talk. In today's episode, we explore three high-impact studies that each offer a unique perspective on modern nephrology, from optimizing biologic use in rare kidney disease to early postpartum kidney screening and the electrolyte effects of diabetes medications. We begin with a timely economic analysis that challenges the practice of lifelong Eculizumab therapy in atypical hemolytic uremic syndrome, a rare condition driven by dysregulation of the complement system leading to thrombotic microangiopathy. Although Eculizumab has proven life-saving, the long-term financial burden is staggering. This study, using a detailed health economic model and data from the Stopping Eculizumab Treatment Safely trial, evaluated the impact of withdrawing Eculizumab and using disease monitoring instead of lifelong therapy. The findings were striking. Over a simulated 80-year lifespan, stopping Eculizumab while monitoring patients not only preserved clinical outcomes, with only half a day of life expectancy lost, but also reduced costs by over £4 million British pounds per patient. Quality-adjusted life years slightly increased, and this withdrawal strategy had a 64% probability of being both more effective and less expensive than continued treatment. These findings support a risk-based, personalized strategy over universal lifelong biologic therapy, with potential to dramatically reduce global healthcare costs while maintaining safety. Next, we turn to an underserved yet high-risk population: women with a history of gestational diabetes. In this prospective study from the United Kingdom, over 800 women returned for structured follow-up just 5 months postpartum. The aim was to identify early signs of kidney disease and cardiovascular risk, regardless of whether these women had progressed to overt type 2 diabetes. The results were compelling. 12% had evidence of kidney injury, primarily elevated urine albumin levels, even though more than 90% of these women had not yet developed type 2 diabetes. Furthermore, 3/4 of the cohort had at least one cardiovascular risk factor, including elevated blood pressure, abnormal glucose levels, excess weight, or abnormal cholesterol levels. 1 in 3 had multiple risk factors. These findings suggest that significant kidney and heart risks emerge well before diabetes is diagnosed and highlight the opportunity for early intervention. Postpartum clinics may be a powerful platform for cardiometabolic prevention, especially in marginalized populations. Finally, we examine the real-world impact of sodium-glucose cotransporter 2 inhibitors, a class of medications increasingly used in kidney and cardiovascular disease, on serum sodium levels in patients with type 2 diabetes. Using data from over 22,000 patients, researchers compared those prescribed SGLT2 inhibitors with those receiving another anti-diabetic class, dipeptidyl peptidase 4 inhibitors, matched for baseline characteristics. The analysis found that patients taking SGLT2 inhibitors had a significantly lower risk of both low and high serum sodium complications, including fewer hospitalizations for hyponatremia and hypernatremia. Specifically, the hazard of severe low sodium events was reduced by 40%, and high sodium events by nearly 50% compared to the control group. This suggests that SGLT2 inhibitors may provide a stabilizing effect on electrolyte balance, in addition to their well-established kidney and heart benefits. Together, these studies highlight the multidimensional nature of modern nephrology care, from deprescribing high-cost treatments in rare diseases to early screening after pregnancy and electrolyte protection with newer glucose-lowering agents. The future of kidney care is becoming more personalized, proactive, and cost-conscious. Join us on Podocyte Talk as we continue to bring you the latest insights into kidney disease research and treatment innovation. Stay tuned for weekly evidence-based episodes that shape the future of nephrology.